Well, hello, Freedom Healthcare family. I would like to introduce you to our next member spotlight, and I'm very proud to introduce today Dr. Kamli Jura, and I'll tell you a little bit about her. She's an experienced pediatrician who believes in listening and healing, listening to the child, to the parents, and to intuition. Many families know and trust her since she moved to the northern Arizona area 18 years ago. Dr. Jura is highly interested in the integration of body and different holistic and traditional approaches. She earned her medical degree from Vilnius University School of Medicine in Vilnius, Lithuania. And Dr. Jura completed a transitional year of residency and pediatric residency at St. Joseph Hospital's Marshfield Clinic in Marshfield, Wisconsin, which provided her the knowledge on how to integrate different teams and approaches for pediatric care. And in addition to English, she is fluent in Lithuanian, Russian, and Polish. Very impressive. So welcome, Kamli, to the member spotlight. How are you today?
I'm good, thank you.
I'm so glad you're here. So let's talk a little bit about what you're doing in Northern Arizona. So let me know the name of the clinic, the ministry, the business. What are you doing in Northern Arizona?
So I created Health Frequency Sedona, and people that are ready to approach their healing with faith and with responsibility reach out to me. And in a way, I do consultations, and the consultations' purpose is to keep them away from hospitals, to keep them away from chronic illness. Kind of my passion really is to see them and help the kids and their families to be healthy. So as part of that, what I do antioxidant assessment, of which, kind of like I scan all the family and I look, what is your diet? Because sometimes body mass index or how we look does not reflect all of that. So we talk about healthy nutrition, we talk about, what are the toxins in our lives, and then we try to reduce the amount and stay healthy.
That's awesome. So you're looking at the whole family, just not the kids.
So, it's funny, I really became pediatrician not to deal with adults. Meaning, because at the time when I was looking what I wanted to do, I actually was very attracted to geriatrics also, and pediatrics and child psychiatry. And, pediatrics look the most holistic because kids usually would get better on their own and you just had to not interfere with it. And now it became more and more that kids are like adults. So in some ways, for me to help kids not to be depressed, not to be in chronic illness paradigm, I have to address the family too.
Yeah.
So I address the family, but my clients are kids below age of 21, and sometimes kids with genetic syndromes or with autism who are adults too.
And that makes so much sense because you're taking care of the kid, but you have to look at the environment that they're living in. That makes so much sense. So with this scope of work and what you do, like, why did you choose this career path for healing? What brought you to this place?
It's a deep question. It's like, really, I chose initially, when I was growing up in Soviet Union, the path of the healer. I thought it will be the least affected by politics. That was my initial, and now I look at it and I see that naturally I was inclined to go to the healing profession. But I also thought that it will be easier to practice it, not being affected by the world or politics, because it looked like, if you want to heal people, nobody will tell you harmful things to do. And so these last years proved me, kind of like showed me really that if I want to be free of politics, I have to create private membership associations where I can talk with people about what it is healing, what it is medical freedom.
Yeah, that's interesting. So you were born and grew up in the Soviet Union, is that correct?
Yes, and then
What brought you here to the US?
freedom, actually, because as a doctor there, I had to pass communism exam. And at that time, then Soviet Union was still in place. And then Soviet Union crashed. I came here as an exchange student to Madison, Wisconsin. And it looked for me that that will be my dream, to be a doctor in America. And then I actually passed all the exams, and I did all the things that required to be a doctor here. But I also started realizing how many restrictions were there as I start practicing.
The restrictions meaning in the Soviet Union or here also?
Here also,
Yeah.
like it's like
It's
you
like you
kind
couldn't
of
get.
didn't want to see that. But then as we start dictating more and more stuff, it's really, it became very similar.
That's too bad because you wouldn't think, coming from the Soviet Union, or what my perception of it might be, that there would be more freedom here to practice or be a healer, but there's really restrictions everywhere, and the control of what someone may want to do to help people and actually heal them. And that's sad.
It is sad, I never actually, I think I seen red flags, but I didn't think until COVID came that we will be mandated so many things, including travel restriction, including lockdowns. It's kind of, for me, I was still practicing in big corporation, and at the time when all it started, I was like, oh, finally we will be able to look at activities, at vitamin D, at zinc, and natural immunity. And then we will look at mental health pandemic and chronic illness pandemic. And none of that happened. Actually, really the kids in America and everywhere else, but seems to me like more in this country were so affected by COVID lockdowns and still are. And up until this day, we keep giving COVID vaccine for 6-month-old, which is very, there is no need for that,
Right.
because, so it's kind of, I don't know, it's like, yeah, that was really eye-opening for me. And so that's why I want to practice in where people take responsibility. And if you want to do something, I can say it's your right to do it, but I'll tell you, these are side effects, these are indications, and everything has side effects, including natural medicine. Many things, like, not, I should say, like, there is always like indications and contraindications for many things, and that's what really we should be focusing on informed consent and freedom.
Absolutely. And a lot of the kids' vaccines, or most of them, aren't even needed either. I think, God made children perfect. We come into this world perfect. And it's like the things that have been put in place by the control. It's like, wait a minute, why you don't need this? Like, why do you need this? So we're definitely starting to see the truth.
My awakening as pediatrician in America really started from hepatitis B when it was introduced for newborns, because there was no need for that unless there were risk factors. And so that's kind of when you start like looking like, if every protocol that they introduce, do I have to follow it? Does it make sense? And for my patients at that time, I gave option not to follow that protocol. And when you kind of start like looking and with COVID, when they really approved it under emergency use for pregnant patients and for breastfeeding moms, and that really was unheard of.
Yeah.
So,
And I mean, so many babies were lost from that. And there were so many bad things that happened, but at least people are starting to wake up. So with what you're doing, how do you fit into this new paradigm of healthcare that we're creating?
so if people come, I still like to see people in person, because telemedicine, I can do rashes on telemedicine. I can probably give consultation, but ideally, I like to establish patients in person, and we signed the healing protocol, and then I kind of see what are the needs. And many times, if the babies are born, I go and I see them at home. And then I also look at their home situation. I look at EMF exposure. Uh, most of my families like to breastfeed their babies. If there is some reason why it's not possible, we collaborate with midwives, and then we try to see if we can get breast milk from other families. So it's essentially in-house consultations, office consultations, and then keeping them from not going to the hospital.
Yep, definitely stay out of the hospitals. So how do you collaborate with Freedom Healthcare, and what do you offer Freedom Healthcare members?
I would think that if they want a consultation, they would need specifically to tell me what's the reason. And sometimes still, if it is not in Arizona state, even if we sign private membership association agreement, there are restrictions. I'm licensed right now in Arizona. So I probably would say it depends from situation, and it depends from location. If anybody comes to Sedona, they can always seek out the consultation even for travel, because right now as we travel, how do we travel? What do we eat? So it can be travel consultation, it can be rash consultation. I am still looking at collaboration with, kind of like how do we do consultations even about, like, for example, stem cells, placenta stem cells. Do people know how to save them? Do people know how to use them? Yeah, so it's still, I think, evolving the way I see it.
Now, I had heard something recently, and you can tell me if this is true or not. Um, when the baby's born, one of the first things they do is cut that umbilical cord. And I had heard that the umbilical cord should stay attached for a longer period of time so the nutrients went back into the baby. How long should that umbilical cord stay attached before they cut it?
I usually leave it up to midwives, because when I go with the babies, the midwives are in charge for the baby. But usually, it seems like long time. I never even looked at the exact time when we cut it, but not right away.
Is it true that it should stay on a little bit longer than normal just to get those nutrients in?
Yes, it is true. Like what I
Okay.
don't know exact time.
Okay. Yeah, I never realized that. I saw that the other day and I thought, wow, I didn't know that. Like we're learning stuff new every day.
So what I now tell families, because I am pediatricians in this country, in many other countries, are trained to take care of the baby when they are born. So as soon as baby comes out of the vaginal area, that's where I know what to do with them, because they didn't train us to deliver the babies. But now if parents want to see me before babies are delivered, I tell them, really ask for placenta to be collected for stem cells. And then many midwives actually provide that service, and they dry it and they make tinctures. And then in the future, that will be your best blood bank.
Wow, that's amazing. So you could dry the placenta. How do you save it once it's dried?
I think that's where I also will go and collaborate with midwives. You put them in the alcohol tinctures. You technically can use the food processor, but it's a little, it's a little.
Maybe you,
It's
you may not want to use a
right.
food
I'm not
processor after that.
You know, like I have several women that do it, and then I give you know, connections to people.
So the babies, if the babies needed stem cells or something later, some immune boost, they could actually use that.
And including mom too, and mom is depressed actually, or if there is any sickness, or you know, in the future, if there will be any need for joint pain, shoulder pain, you know,
For
that's
the mom and the baby, or just the
yeah,
baby?
for the whole family actually.
That's amazing. I had
And
no idea.
that's what I kind of like. I want, like, I have collaboration with midwives, and they dry the placenta, and then they give moms the tinctures of, you know, but if we could probably collaborate nationwide, because this is so much better than getting somebody else's stem cells, or waiting
Oh,
until you're old and getting your own platelets.
absolutely. Okay, you have a task. You're going to work on
Oh no,
this.
no, I actually I went to anti-aging conference, and I wanted to collaborate with people, but see, a lot of those stem cells banks, that's a very expensive business. I think
Yeah.
this could be very interesting business for us to focus on.
Yeah, I think it's a great idea, especially since we have pure blood ministry, but
Right.
just
So
the idea of you listing out like what somebody would need to do, just like do this, dry this, you know, save it, whatever. Just even that listing, so mamas have a choice to know that they could actually do this and save it, and how beneficial it could be in the future. You know, just writing something out would be great.
And you know, it's not so expensive. The midwives charge like 250 to make those tinctures. And if you're in the hospital, then you want to make sure that you ask them to put it in a freezer, you know, and then you take it back home, you put it in a refrigerator, and then you can still do it.
That's amazing. Every mama needs to know that, like seriously, because we know that when you're in the hospital, and whether it's organs or other things, they're taking those and they're selling them. So if mamas don't know that they should be saving that placenta, that hospital's doing something with it. So why shouldn't the mama and the family have every right to take that home?
And for me, really, if you're not delivering at home, and if you didn't talk with your midwife about this process, if you go to the hospital, I know it can be overwhelming, but that's one of the most important things also to address.
You know what? You made me think of something, and I'll make a note when we're done, because we have on the website an advocacy toolkit, and it's a list of about 15 documents that will help people when they're in the hospital, whether it's a birthing plan, whether it's advocacy in the hospital. But we need to create something just so that mamas have that to tell the hospital with their signature, this is what I want. If they're in there, I want it saved, I've signed it, you know, and that way they get it back. So I'll work on that and make sure we have something like that. That's
And
really,
also, like, the list of people, like, I have two people that I know I can give moms, you know, their number, and they will drive a placenta and will give them. And sometimes I know that $250, $250, you know, it's like babies are expensive. But then if you think about future, this is your
oh,
bank, you know.
absolutely. $250 for health in the future. Oh my goodness.
And the moms now, I ask them when they come, I say, did you do that? They say yes. And then I say, do you remember that you have it in your fridge? And some of them did not remember it. And then if I remind them, and if they don't feel good, like that's the best antidepressant for the mom. And you just
Wow.
you don't want to use it all. You kind of, because like in all these anti-aging conferences, when I went there and then I saw what they want to charge for you to put your own stem cells in the banks, and so we kind of like this is like, I think, a good business for freedom, for everyone.
Yeah. Well, and everything we have to focus on for everybody is getting people healthy and keeping them there.
Mhm. Yeah.
Like, so they're not dealing with the rest. All right. So what one key point or takeaway would you like to share with everybody watching today?
I feel if we take responsibility for our own health and our own freedom and really find partnerships where you feel heard, but also remember that we all also need to hear our own voice, and listen to our own intuition and follow it.
Yeah, I agree. And something you said is really key. We've been so used to just going to a doctor and having them hand medications. Well, people have to take responsibility for their health. They have to go, yes, I want to get healthy. I have to be responsible for it and not depend on someone else taking care of them and just being handed pharmaceuticals.
And another thing, what I notice, people really contact me in emergencies. And my point is, invest in your health before emergency, invest to be healthy,
Yes,
and somehow, and that's really difficult paradigm to break, because people are trained to go to emergency room, to go to urgent care, but actually if you start investing from the beginning, including your placenta, your stem cells, and then later kind of see what kind of healing, uh, like homeopathy or quantum medicine, what do you want to have at home to help you in case you need something.
absolutely. Absolutely. That's brilliant, Kamli. Well, thank you for being with us today. This was a great discussion. I hope everybody enjoyed Kamli and the discussion that we had, and you can find her on our website, connect with her directly. So thank you, Dr. Jura, for being with us today, and everybody stay tuned for the next member spotlight. Have a good day.
You too. Bye bye.